Hi everyone, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about Indian Health Services. I'm just going to do a very high level overview about what Indian Health Services are and why you might need to know about them depending on where you're located in the country and operating a practice. I'm still learning a lot of this myself, to be honest, because this is something that isn't super common in Oregon and in other places where I have worked. However, I have had clients that do bill Indian Health Services because they see patients who are Native American and receive this benefit through the federal government. Indian Health Services is part of the federal government. It is not an insurance per se, it's a whole program. Most Native Americans who are on this plan, on this benefit, I should say, usually go to kind of like the veterans. They are encouraged to stay on the reservation and go to the IHS facilities and hospitals and doctors, things like that. Those hospitals, facilities, everything will bill other insurances, and it's subsidized by the federal government with the funding for the tribes. Because of the lack of full services many places have on the reservations, they do often have to refer out. And that is for specialists such as, usually OBGYNs, pregnancies, things like that, cancer treatments, any specialized care that they're not able to provide. It's very unfortunate. However, a lot of these services are underserved, even in the tribal community. So it does force a lot of patients to have to go off the reservation or outside of the IHS facilities and hospitals to receive their services. In these situations, the private independent medical practices where these patients are being referred to can bill IHS for coverage of services that they offer. This is through I have it written down, purchased/referred care program that IHS has. The services rendered are at a base rate, and it's a all-inclusive payment, basically by encounter. It's not based off each service that's offered. It is very difficult, from what I was reading, to get some of these services covered for patients because it has to be approved by the IHS, and they also have to have the available funds to reimburse these third parties. I guess you can consider them third parties since they are doctors and specialists outside of the IHS service area. A lot of people are saying, from what I read, that this is very broken because it's very underserved, it's underfunded, it's understaffed, people to review these requests, things like that. And it sounds like a lot of the independent outside the IHS facilities, providers, and things like that are not as willing to see patients under this program because of the lack of payment. And then they feel bad when they have to send a bill to patients, because the whole point of the Native Americans being on this is so that they have their health paid for. That doesn't mean that these independent providers are not billing if they have a commercial insurance or Medicare or Medicaid, things like that. They will. However, it's supposed to also be paid for or subsidized by the IHS. It sounds like it really does need to be revamped and redone, and it's putting a lot of people in very awkward situations. It's putting the specialists that are receiving the referrals for these patients in an awkward situation of not receiving what they should for services rendered, and then they have to bill patients, and then patients get upset with them because they get a bill, and then you have patients that just decide, I can't afford it and I'm probably going to be stuck with a bill, and they don't get the care. It's not good either way. It sounds like it really does need a close look and revamping to make it worth everybody's benefit to have a better worked out process, approvals, payments, and for patients to feel good about that and confident that they can get the services they need and it will be covered. Again, if these patients were to be seen at the tribal facilities that have IHS, then they also bill other insurances. So if a patient has commercial insurance through an employer or they're on the Medicare program, they all bill just like any other medical facility would, but then it should be subsidized by the extra money from the federal government to pay for the services that are not covered or the other expenses that come up. Again, I'm still learning about this, but if you live in a state where you are close to reservations, where you could be serving Native Americans, you might want to look into this of joining the program if you want to see patients and help them out, especially if you are in a focused specialty that they most likely wouldn't have on the reservation. My client is in North Dakota, and there are a lot of native tribes up there and reservations. And they have a few different specialties because they're multi-specialty. So they have always accepted IHS. However, they do run into some challenges, but not to my knowledge, the extreme that I was reading about. They just have to wait a long time to get paid. So if a patient doesn't really have any other insurance and they're waiting to get reimbursement from the program, it does take a while. I think they just got payment for something that was rendered like a year and a half ago. So that's something to keep in mind, but it's doing such a good thing. It's helping out your community. And the more that you bill it and you learn about it, the better you'll get at it. That's how we all are with things, right? So if you live in an area that's close to a reservation, to a tribal community, and you want to offer your services that are probably needed to those individuals, please look into this a little bit further. Again, if you learn anything or know something that I haven't mentioned in this that is important for other people to consider or know about, please leave that in the comments below. It's very helpful that we help each other out. And although I'm not an expert at this topic at all, and I'm still learning myself, I wanted to put it out there because we do live in a country where a lot of us are located close to these different geographical locations. And anything that we can do to help one another is always, in my opinion, worth putting the attention and the notice out there to help. If you have any questions or comments about this topic, I will do my best to try to answer, but I can't make any promises I can. But maybe someone else in the community could help answer those questions, so don't hesitate to leave it in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. I appreciate the support, and we will see you next time. Bye-bye.